Republican Congressman Rodney Davis of Illinois. He's a member of the Tuesday Morning Group. That is a group of the more moderate Republicans in the Republican House caucus. They have been involved in some of these negotiations. Congressman, good morning. Have you personally been involved with meetings with the administration on this subject, and do you believe you're closer to a deal?
Well, good morning. Thanks for having me on. And the answer to that is yes. I have been engaged. I've got to give the Vice President, Chief of Staff Reince Priebus, and also my colleagues like Mark Meadows, who you just heard from, a lot of credit for sitting down and let's try to work out a good compromise, a principled compromise that's going to give all Americans access to affordable and accessible health care.
All right, so you say all Americans access to affordable health care. One of the things some of your fellow Republicans on the Freedom Caucus want, and it's getting them closer to a yes, is basically an elimination or the state's rights to opt out of what's called this community rating. That would essentially gut the protection for pre-existing conditions, because it would mean that really sick people could have to pay a whole lot more for insurance. Can you live with that? Is that something you're comfortable with voting yes on if that's in the final draft?
Well, there is no final draft, and that's why we're talking.
But that's my question, Congressman. If it's in there, because it sounds like it's going to take that to get some of these Freedom Caucus members to yes, can you vote yes on that?
Well, I'm not going to speculate on what will or will not be in a final piece of legislation. What I can tell you is, as the husband of a cancer survivor, pre-existing conditions and making sure that families that are going through the same thing that my family went through 17 years ago don't have to worry about getting coverage and also having to reach a lifetime cap. These are essential parts of what I've campaigned on and what many of the folks that I serve with really care about the most. So we'll see what that final bill looks like, and then I'll give you a comment on whether or not I'm going to support it.
Let me ask you this in a different way. Do you believe that the community rating is essential to protecting people with pre-existing conditions?
Well, what I can tell you is when we talk about community rating, we talk about essential health benefits. Many states right now have more stringent health benefits than the federal government requires. However,
but some don't, Congressman, but some don't.
Some
don't.
But
and we're talking
some
about,
do,
you know,
like,
okay, go ahead.
Some do, like my home state of Illinois. But I wouldn't speculate that those essential health benefits are going to go away at this point. There's discussions going on. What we're doing is we're trying to talk between many different groups, many different priorities, and I've really got to commend the White House and Vice President Pence and Chief of Staff Reince Priebus and their team for really working together and sitting us down in a room to find out where we can find common ground. And frankly, after a very long meeting last night and meetings the day before, there are areas that we are agreeing on, and there are going to be some that we don't, and we'll see what the final bill looks like.
Do you think the president deserves some credit here on his deal-making ability? Yes, the first deal failed, but it seems a bit like he scared a bunch of the Republicans by saying, all right, forget you, I'm going to work with the Democrats. Did that get you guys rallied and get you guys into action?
Well, I'm actually very impressed with the president's willingness to make sure that the White House and the White House team and the vice president and even himself have been available throughout this entire health care debate. As a matter of fact, I spent 2 meetings, an hour each time at the White House a few weeks ago before the first bill was pulled, and the president was clearly supportive of our efforts. And that's why I want to give him credit and his administration credit for getting us together again, because although that was something that I was not expecting to see when the bill was pulled, I think it's a good marker and a good movement to show that we can come together and govern. And that's what I was sent here to do by my constituents.
Where has this bill or the discussion, where has it moved closer to where you are? You were supportive. You would have voted for the original bill had it come up for a vote, but there were members in the Tuesday group who would not because they were concerned about essential benefits and other things. Where has it moved closer to those concerns, Congressman?
Well, first off, I don't speak for the Tuesday group, I speak for me. But there are some areas in debates and discussions in ensuring that states are going to be able to insure high-risk patients. Those are the types of issues where we've found some common ground. But again, we're in a discussion stage. The fact that we're all sitting together in a room, I think, is imperative to note that that's the way that we come to success throughout the legislative process out here in Washington.
All right, take a look at this Gallup poll. This is a brand new Gallup poll on how Americans feel about Obamacare. Right now, 55% approve of Obamacare, and then when you dig into the numbers, 40% want to keep the law but make significant changes, 30% want it to be repealed, and 26% want to keep it as it is. So the headline there, more and more people approve of it, but you only have 26% of people who want it as is. Are you concerned at all about something that looks like almost a full repeal with more than half of Americans supportive of it?
Well, remember, a lot of the rhetoric is semantics. When we talk about repealing and replacing, that's essentially a fix. I'm somebody who's actually passed laws to actually fix Obamacare in the past. We've got unanimous support, Democrat support, to do things like hire more veterans. I passed a law that actually had the requirement of the 50 employee or less, the employer mandate, would not apply to veterans who were getting health care through the VA or DOD, therefore incentivizing small businesses to hire veterans. These are solutions that have happened even during a divided government and a politically charged time. We're all working to fix the problems in our health care delivery system that Obamacare has created. And it's a fact. We have 31 million people in this country who can't afford to use the coverage that they have under the existing law. 29 million people still choose not to get insurance. That is not success, which is why we have to come together to get a better system that's going to help all Americans, and that's what we're trying to do.
You gonna get a vote this week, Congressman?
I don't know. I'm not going to speculate on that, but if we can come to an agreement, maybe it'll happen.
All right, Congressman Rodney Davis of Illinois, thank you.